I'm here on the campus of the River Hills Community Health Center in Centerville, Iowa. This facility is slated to close on July 31st. It's the only federally supported sliding scale health center in Appanoose County and many surrounding counties. These people from Senate District 13 are in trouble. Appanoose is the poorest county in the state of Iowa. My home county, Wapello, is neck and neck with this one, so we understand hardship and hard times. Employees are very worried about their patients who will lose their health care. It's a dark day. Many of them plan to follow their provider to wherever they go. The people I talked to expected to have to drive 45 miles to Ottumwa for their health care. That's a unique problem here because the Amish community is a very large factor in this health clinic. They don't drive cars. They hire drivers to shuttle them. So that's a big expense to go 45 miles away for a doctor's appointment. With gas prices over $4 a gallon, many people here cannot afford to drive a 90-mile round trip. All the people who need service are not able to get it. And it's not fair. It's not American. And this is not how Iowa is supposed to be. I talked to employees of River Hills at the Centerville facility at a rally downtown where they're trying to save their clinic. Employees are very concerned about their patients, and they're concerned about themselves. These are job losses for people who have been longtime employees, and it's in a place where there are not many options.
It breaks my heart for the patients and seeing how it's devastating all the employees, everybody. Patients crying, it's not good. So,
No, the relationships that we have with our healthcare providers are personal and they're important. And feeling secure and protected is a building block of health. So I understand how difficult this is. It's a human rights issue, healthcare is, in Iowa and in America as a whole.
patients come in and we have known them, like I've worked there 3.5 years, and you get to know your patients. And they'll walk in the door and I'll call them by name. And they're like, oh, you know who I am. I'm coming here too often. But I think they like that because they're not just a patient. They're also, I'm trying to make them someone, feel important, feel relaxed, because I'm the first person they see when they walk in the clinic. So if I can ease their anxiety, making them feel more comfortable, then it's easier for the provider when they go in the back.
Most people have dental anxiety.
Yes.
It's a thing.
Yes.
So that does matter.
Yeah.
It does.
And I think, it's so close knit. We try to really interact with the patients. And I think that's one thing they like too. We know them. We've known them for a long time. So
Healthcare is not like getting an oil change. I want to see the same person all the time and know that they know me from the next person and that they have record and memory of my particular health issues.
Mm-hmm.
It's important. But
Yep.
thank you,
You're
Shannon,
welcome.
and good luck to you.
Thank
I
you.
hope we can save this clinic and you don't have to move.
I hope so too. It would be
It's
the best thing
important.
for the community. Definitely.
Thank you.
You're welcome.
I'm back at River Hills Community Health Center in Centerville, Iowa, where the countdown to closing continues. I met today with members of Teamsters Local 90, the union that River Hills employees joined. Also, I talked to a receptionist and a nurse about the challenges they face both in their professions and with River Hills in particular. Let's hear what they have to say. I'm in Centerville with Logan Thomas of River Hills Community Health Center. He is a nurse and a member of Teamsters Local 90. Logan, tell us about how River Hills came to unionize.
Yeah. I'm proud to be a nurse. I'm proud to be a brand new member of Teamsters Local 90 through River Hills United. A year ago, well over a year ago now, we at River Hills were talking a lot about how we weren't listened to and how things were going declining and how the situations were getting worse and how it wasn't looking like there was an end to it. We spoke amongst each other on a low level, and for a year then drove a campaign to unionize, not just nurses, not just providers, not just people with certifications or license, but wall to wall receptionists, interpreters, everyone that is employed at River Hills. We had filed for election. We were at a point where we could file for election at the end of last summer. It was delayed for 6 months with River Hills legal delays.
This at the Ottumwa campus?
At the Ottumwa. We filed at the Ottumwa, the main clinic that covered medical, dental, and all of the, or medical pediatrics and all of the auxiliary staff like lab, radiology, stuff like that, and gynecology. We filed for election there. It was delayed. We finally got to vote in February. We won our campaign, or we won our election, and we're certified through Teamsters Local 90. Moving on from there, we immediately began pushing forward our Centerville vote. Where we were at in the process is very, very specific to what happened with the closure announcement in Centerville. We had filed for election in Centerville. There were minutes left before a deadline for a decision that needed to be made by River Hills regarding their position on the election, any sort of legal thing they wanted to file. Minutes away, and they hurried to Centerville Clinic while our CEO was out of town, out of state, and told them over their lunch break that they were closing. They wouldn't have a job as of July 31st. Please sign our severance agreement right now, and go back and start seeing patients in a half hour.
That's brutal. I'm thinking about how hard that would be, because you're thinking, I'm going to lose my job. Where am I going to work? And by the way, go back and help these sick people with professionalism and compassion.
Yeah.
And it sounds like a tremendously burdensome and brutal way to handle such a sensitive topic.
Yeah. And it's about budget and finances, and other places are having to make this decision. We're not here to make a profit. We're not here to make the financials look good. River Hills was never established as something that was making with the intent to make profit. We are a nonprofit. We have federal grants. We are intended to serve people who struggle to afford healthcare, people who don't have insurance or don't have good insurance, can't afford their medications, can't afford specialists. That's what we're here for. And citing financials for that is difficult to believe.
Right. I personally think that there are 3 industries that should never be for profit. It's healthcare, prisons, and education.
Yes.
Because what you use to make money increases, and we don't want to make more sick and hurt people.
Yeah.
So these are one of the most vulnerable populations around.
Yeah, we're a public service, and as employees, we asked for a democratic voice in our workplace, a seat at the table with decisions that are made that affect all of us and all of our patients. And it seems like that was too much of an ask for admin, enough to result in loss of healthcare access to an entire community over here in Centerville.
It feels to me, just listening to you and reading up on this, that pulling the clinic, closing this clinic, was maybe an act of revenge on behalf of River Hills management, that their folks unionized and they didn't want this one to do it, so they just closed. And I really hope that's not true, but it's very suspect because of the timing and because they cited financial reasons, and then immediately opened a second location in Ottumwa.
Yes. Yeah.
So if you don't have any money, how do you buy a building and start a new?
We're already struggling to stay afloat with with a couple other clinics that closed in Ottumwa. Thousands upon thousands of patients flooding to whatever clinics they can get into. And River Hills happens to have taken on, just the provider that I work for alone, several hundred at the very least. As just a baseline estimate. We need people that are willing to see patients. Centerville is a community in desperate need of affordable healthcare that goes out of their way to take care of them. We're a public service. We shouldn't have to be arguing about profits.
expect, when I think about medical personnel and nurses in particular, I think about compassion and altruism, and that you have a calling,
Yeah.
and that you shouldn't be worrying about, can this patient pay? You need, your focus would be on making that patient better.
Yeah.
Is that-
It should be, and it is. It is on our end. We don't worry about their ability to pay. We don't ask them anything about that while they're here. Our concern is getting them the treatments they need, the healthcare they need, and the follow through that will keep them alive longer and healthier. You know, that's our focus, and that is our main goal as healthcare providers. And I think often our compassion and our desire to treat patients is weaponized against us when it comes to forming unions. Aren't you gonna? How are you gonna leave your patients alone? What if you have to go on strike? What are you gonna tell your patients? We can better serve our patients when we make decisions that affect our workplace. And we are the ones that are with the patients every single day, every single hour. The people making the decisions on our patients and our behalf are not.
That wouldn't be the nurses closing anything or abandoning patients. That would be, in my view, the management doing that by not cooperating with the support people, with the actual hands-on medical.
Yeah.
Can you give me the top, if you had a magic wand, or I did, and I could wave it and say, these things will be fixed for all nurses. What are your top few things in need of change in the field of nursing?
Safety, especially for our brothers and sisters at hospitals where they treat more acute patients. Safety, staffing ratios is kind of related to that, as well as just resources, and then access to healthcare ourselves. One of the driving factors of our campaign at River Hills was how astronomically expensive it is for people to afford our insurance program, just our insurance. $1,000 a month if you have a family and you don't want to pay a high deductible.
Wait.
Yeah.
You as employees have to pay $1,000 a month for your family health care insurance?
Yep. If it's a family plan and you don't want to pay a high deductible, now management came out and told us towards the beginning of the campaign that that's not intended for us. We're supposed to be on the economy plan. That's the Cadillac plan. We should contribute towards the HSA and be prepared to pay for a high deductible if we have child or we do anything, we have an emergency, anything that may happen in healthcare. We provide healthcare for people. We cannot afford healthcare ourselves.
That's wrong. It's un-American, and it's just plain wicked to not put too fine a point on it. That's no good. Can you tell me a little more about the safety threats in nursing? What do you mean when you say my safety?
Yeah, our brothers and sisters at Unity Point in Des Moines inspired our campaign in many ways, and they know firsthand the poor ratios, the way that nurses are asked to care for more and more. But even just at River Hills, we had a employee who received a write-up for calling 911 on for her own safety without consulting with management first. We were under the understanding that 911 existed, emergency services, police, fire, EMS existed to come no matter who needed it, and you don't have to consult your boss in order to call them.
Now, if you're physically in danger, I wouldn't think you would have to.
Yeah, and so we had to fight for panic buttons, things like that. We work with the general public. We love our patients, but that doesn't mean there's not people that come in that are disturbed or having problems, angry at us for something that happened. It's just something that happens when you're in public and you work with the public. It's a risk that everyone runs, especially people that have to be right next to patients, working with them, and are responsible for a lot of what they go through in a day-to-day basis.
Are these based often in mental health issues or substance abuse issues, or are patients combative for other reasons?
Any number of reasons. I know at Unity Point, it's just a patient safety thing by numbers of nurses being able to get into how many patients one nurse is asked to care for. It's life or death for some patients that go to the ER, the ICU, that need a nurse with them that isn't caring for 7 other patients. And it kind of goes for us, like our safety and patient safety at River Hills too. We have 350 referrals that come in per week. especially now that we're taking a huge influx of patients. We don't have the resources. We're not being listened to. We're being pushed more and more upon us, while not being compensated any extra for it. And we're responsible for caring for these patients' cardiology appointments, surgeries, things that save their lives or promote a good quality of life that will give them time to be healthy for longer, to enjoy their family, to enjoy their life for longer. So,
Well, thank you very much,
yes.
Logan, for talking to me about this. And I think that going union is exactly the right thing to do.
Mhm.
Stand together and take care of each other
Yeah.
the way you take care of your patients.
Yes, democratize your workplace.
Yeah.
That's my advice for everyone, no matter where you work.
Thank you so much.
Yeah, thank you. Thanks for all that you do.
I'm back at River Hills Community Health Center in Centerville, Iowa, where the countdown to closing continues. I met today with members of Teamsters Local 90, the union that River Hills employees joined. Also, I talked to a receptionist and a nurse about the challenges they face both in their professions and with River Hills in particular. Let's hear what they have to say. I'm Brenda Case, candidate for State Senate District 13, and I'm here in Centerville to stand by nurses who are unionizing with Teamsters Local 90. They're employees of River Hills Community Health Center. Here, my friend is an employee of the River Hills Community Health Center in Centerville. We met when I came down to ask what's going on and why is the center closing and how is it going to affect your people. So tell me, friend, about how this is impacting your patients, your coworkers, and maybe as wide as the whole area.
It's not good. I mean, the morale at the clinic is down because it's just devastating. We feel for the patients. We feel for our friends who are employees. When they notified us, it was just kind of they came in, told us, and then left. And then we were supposed to go back to work with, all stunned, see patients. Yeah, it was just devastating. And it's going to hurt the community so bad because, we take Medicaid and there's so many Medicaid patients in this area and they don't know what they're going to do now. And, we have the sliding scale, which is federally funded, and there's people that pay out of pocket, but they could have a bunch of dental work done for $50, $60. That's huge for someone that can't afford it, who's not working, but still needs the dental help.
That's an important part is a lot of the people who are suffering in poverty and they can't afford big health insurance or medical bills. Sliding scale allows them to be treated at all.
Yes.
Yep. Go back to when you got that news, it must have been terrifying.
It was. We had actually been all told that in the middle of the day that we needed to all be in the break room at 12:30. We were sitting there. We seen the HR lady come in and one other admin, and none of us knew what was going on. We had no idea. We were sitting there just kind of waiting. They decided that they were going to close us down effective July 31st, and we were all stunned. People were crying. We had a couple employees get up and walk out. They were so upset. It's devastating because some of us have worked there long time. We have people 11 years, 10 years, and they have no jobs for us. None.
What are the prospects within, say, a 30-mile radius of Centerville to find an equivalent job?
I know that from the dental aspect, because that's what I focus on is dental, our hygienists are having a really hard time. They're not going to be able to get anything in this area. The majority of them are either going to have to drive to Albia, Ottumwa, Bloomfield. I mean, at least a half hour, 45-minute drive from where they live. And this was just convenient for everybody. A lot of the employees, the patients. I mean, we have so many patients that they can't drive. They're older. They need help. They rely on people. And, I don't know what they're going to do now.
This is a conclusion to our 4-part series on why is River Hills Community Health Center closing their Centerville facility. It seemed like when I walked into this that it had to do with the poor Medicaid reimbursements. The reimbursements are too low, they're too late, But there's more to the story. The company is a 501c3 charitable organization. So let's start there with what that is and what it's not. When an organization gets a 501c3 status from the Internal Revenue Service, they don't have to pay federal income tax. Key employees and board members can collect a salary. The IRS says that salary must be reasonable. And the criteria for that is, could that person earn a similar amount in the private sector? So let's take a look at what the earnings are among River Hill's top executives and major employees. Now, does being a nonprofit mean that those who work there are so charitable and so kind that they work for free? No. It doesn't. Does it mean that the company does not earn any money, that they function at such low rates they just don't charge? No, it's not that either. What a nonprofit does is they operate their business and they have income, revenue that comes in, and this kind of a charity gets federal grants, and individuals can make donations tax-free. So that's where River Hills gets most of its money, plus from the Medicaid and general insurance reimbursements for services. So those are revenue, subtract the expenses, and we have income. And let's look at what River Hills has had for income. Then you be the judge on whether they need to close a facility or are they doing well enough. What was different in 2025? Unionization of the employees. They got together, they joined Teamsters Local 90, and they demanded better, more fair pay, a better, more humane patient-to-nurse ratio. They have safety concerns. We, as citizens, can help influence this by signing the petition that Teamsters Local 90 has supplied, and I will put the link to that in the comments, and call River Hills. Call them up, River Hills in Ottumwa, and let them know how you feel about what they're doing. Their mission is to help poor and needy people get good health care, and they're doing the very opposite.